Okay, so welcome everyone. We're very happy to have you today at the Welsh Open Market Consultation for the suHCO PCP project. So we'll go through what all of those different words and stuff mean as we go through the presentation. So the main aim of the session today really is to open a dialogue with the market about the suHCO project and about pre-commercial procurement or PCP projects in general. And the objectives are to ensure that you understand the scope of the project, to ensure that everybody achieves a common understanding of PCP processes, and also to give you the opportunity to consult with other potential suppliers of R&D solutions and to potentially facilitate establishing some partnerships between potential suppliers. So before we get into the content, I'll just give a little bit of a few housekeeping things. So the meeting, including the Q&A, will be recorded, and during the Q&A, we'll open up the mics and the video. So please turn on your mic and video if you have a question and you'd like to speak. And please use the Q&A function for any questions that you have. And we'll come to those during that section. And then in terms of the chat, please reserve that for networking. So feel free to introduce yourself in the chat, put your name in there, a little bit about yourself and your contact details. And you never know, that might be the start of an interesting partnership for the project. And then after the presentation or after the event today, we will go through all of this again, but the slides and the recording will be shared on the suHCO website, and there are multiple other ways that you can stay informed about the project, which we'll detail in later slides. And then just again, before we get into the main content, I'll introduce myself and my colleague as well. So I'm Amy Campbell. I'm a research associate at TriTech. So we are part of the Research Value and Innovation Directorate within Hywel University Health Board. And we are the area really for any innovation projects, and we're a little bit of a commercial facing arm for the health board as well. So one of the projects that we're working on is suHCO, and I'll let you introduce yourself as well, Matt.
My name's Matt Lawrence, so I'm the deputy head of TriTech. I work with Amy at Hywel University Health Board.
So now we'll get into the main content, and I'll give you a little bit of a summary of the suHCO challenge and the challenge that the project is trying to kind of meet and overcome. So within the health and care sector, there's massive potential to increase sustainability and to really make gains and make wins within the sustainability space. So we emit quite a lot of greenhouse gases, up to around 5% of greenhouse gas global emissions. We produce a lot of waste, and particularly around disposables. Within healthcare, there's obviously a large kind of focus on infection control, and that leads to a lot of linearity and waste and single use within our systems. And we produce a lot of non-hazardous waste as well. Most of our sector emissions come from the supply chain, and the supply chain is also quite vulnerable because of complex global structures. So to really bring all of those stats and numbers into focus, on the right hand side of the slide here, we have a piece of art or a visual representation that was created by a breast cancer patient after her breast reconstruction surgery. So she gathered all of the waste and disposables that were associated with that procedure, and she represented them here in this image. So it's quite striking to see the amount of waste that can be produced just from one operation, and that's not even the kind of full extent of the waste because there's no packaging on the image here. So it really kind of distills the challenge and what we're trying to overcome. So the aim really is to go from a linear economy where things go to landfill after being used once or a minimal number of times, and work towards a circular economy. So where we use as few items for as long as possible, really wanting to stay within one loop of reusing something indefinitely or as much as we can. And then if we can't reuse something consistently, thinking about how we can repair or refurbish a product to reuse reuse it as many times as possible. And if that's not possible, to then think about how a product can be recycled and put back into use within the health and care sector. And basically the ultimate aim is to avoid things going to landfill. However, it's really not an easy task to achieve, and there are many different factors which can make this either difficult or impossible. These might relate to kind of limitations in the legal and regulatory space, and around kind of expertise within and outside of the health boards or within and outside of the sector, commitment to the cause and cultural change within organisations, and also a big one as well is data availability. So if we want to make a change to our processes, that needs to be data driven. We need to be able to show that it's going to be safe, cost effective, efficient and effective, and those data aren't always available to assess whether that's going to be the case. So within this project then, 3 leading health and care organisations are coming together along with a wide-reaching follower network to really try to overcome this common challenge of accelerating the sustainability transition within health and care organisations. The structure of the project is going to be a pre-commercial procurement project, which Matt will go over in more detail in later slides, and it's associated with an investment of over €2.8 million. So we have 3 procurers within the project, and CSC is a very large health and care organisation based in Catalonia in Spain. Then we have EnEA, who are an organisation based in Treviso in northern Italy. They provide residential and community care to elderly residents within the area. And then we have ourselves within Wales, so we're Hywel University Health Board. We are one of 7 health boards within the Welsh NHS system. Then we also have 3 supporting partners. So 2 of those are based in Germany. They're Empirica and BME. And then we also have another Welsh organisation supporting the project, who are the Bevan Commission, based in Swansea University. We also have currently 31 members of the follower network. That will increase as the project goes on. And our followers are basically other health and care organisations or other public bodies and projects who are interested in seeing what comes out of this project, the prototypes, and also the other kind of outcomes that might come as a result of suHCO. So there's the potential to reach quite a broad audience within this project as well. So we can define our challenge according to 4 main building blocks. So the areas are information, operation, organisation, and change and upskilling. And then our defined needs within those areas are as follows. So when it comes to information, we want improved access to sustainable case studies and legal and procurement information or knowledge. On an operational level, we want structure and guidance for making sustainable actions and achieving operational effectiveness. On an organisational level, we want one platform which can help us to increase the efficiency of the organisation when we're making sustainable decisions and taking sustainable actions. And then we would also like access to customised capacity building and training for our organisation members. So what is the aim, what is the scope of suHCO, and what would we be looking for from potential suppliers? So we're currently in phase 1 of the project, and that phase is basically focused on data and intelligence gathering. So as part of phase 1, we've been conducting across the 3 health and care organisations and also our supporting partners, we've been conducting focus groups, interviews, literature searches, and surveys with key decision makers, and gathering and analysing all of the data from those. And as part of those, we have basically defined potential user groups and personas that would interact with any system or platform that's produced as a result of this project. And full details of those will be shared in the upcoming international OMC, which will be later on in the month, and details of which we'll share in later slides. And then we've also really honed in our challenge brief, what the challenge is that we're facing and what specific things we're looking for as well. So details of all of that will follow in another event. But we can give an outline of what it is that we would and also would not like from the project. And from the solution that's developed as part of the project. So we'd like a solution that is able to cover all departments, sectors, value chains within our organisations. Essentially what we're not looking for is one very specific solution that targets a specific department or a specific group or process within the organisation. We would like to look at basically maximising the impacts of the circularity and reuse strategies, and not just kind of squeezing the last little bit out of a process that's maybe already in the process of being perfected. So if we, instead of looking at one process and saying how can we really make that perfect, and maybe make a 1% decrease in emissions associated with one specific process, we're interested in looking across the whole organisation and saying, okay, there's a process over here where we can reduce our emissions by 20%. Let's focus on that and go for the low-hanging fruit. So really kind of a wide-ranging, large impact solution. And we'd like the solution to be able to slot into any health and care organisation independent of where they're starting. So even if a health and care organisation isn't massively developed in terms of its sustainability journey, if that's not an area that it has a lot of resource or previously has put a lot of resource into, the solution should just work just as well for those kinds of organisations as for organisations who have sustainability fully embedded within all of their processes. Arguably, there would be more of a need for this solution in organisations who are starting at an earlier or more naive point. When it comes to the use of AI within the platform, that's welcomed, but what we're not looking for is the use of AI for AI's sake. We really want to think about how it can meaningfully add value to the system or to the platform that's created as part of the project. And then any platform that's developed or any prototype that's developed needs to be scalable across a wide range or all health and care organisations in a long-term way. So not just looking at something that's specific to the 3 procurers that are involved in this project, but something that can really cut across the whole sector. So within tenders or tenderers, what we're looking for is the ability to perform R&D. So this project is focused on the kind of first development of products and prototypes. So there will be a lot of R&D work within the process. And we would like you to be able to demonstrate that you have expertise in developing platform solutions, so IT and AI expertise, also expertise in circular economy and sustainability areas and in the sector of health and care organisations. And also it needs to be demonstrable that you have the ability to commercially exploit any results of the PCP. And that's not just the actual prototypes, but those intangible results and the IP rights and all of those things that come along with the process as well. So essentially, to sum it all up, the project isn't looking for one specific solution. We, as the buyers group and the procurers, have defined what is ultimately a very complex problem and set of criteria that we are looking for. And then it's up to the suppliers to work together to define a solution. And there are many different ways that that solution could look. It just really needs to meet the needs that we have specified. So that is everything from me. I'll hand over to my colleague Matt now to go through the rest.
Hi, yeah, so Amy sort of set the scene, and my job will be to just sort of talk about the process a little bit. The first thing I'm going to talk about is what a pre-commercial procurement actually is, in case people aren't aware. So I'm just going to sort of work through that. So yeah, in this section, just what I'll do in this bit is just sort of talk about what traditional procurement looks like, and then what we're doing here in this PCP process. So in traditional procurement, it's generally one procurer and one supplier. you're generally looking at a low number of solutions to the problem. So a supplier is generally, it's based on existing technology, based on existing intellectual property, based on an existing solution, which is then trying to fit a square peg maybe into a round hole, and maybe not also really addressing the greater need. So it's maybe trying to fix a short-term problem rather than looking at something that's more long-term and fixes the whole system. It's generally all done in sort of one very quick phase. There's not a lot of reflection on the solution that's been developed or being used. And so traditional procurement sort of has lots of limitations to it. In contrast, a PCP process generally has quite a large buyers group. As you can see here, we've got three procurers from different health systems with potentially different needs, but also trying to address the same type of problem. Again, it's not open to one supplier. It's a large tender process, and anybody can get involved. It's not looking at just one supplier. It could be several suppliers coming up with a different type of solution. It could be a consortium of suppliers working together to try and address the solution if you don't have all the skill sets within your own organisation to address the problem. But we would encourage people to work together to come up with a more complete solution. And the big benefit of work doing it like this is it comes across as there's lots of ideas can be generated, lots of different types of solutions, lots of different people in the room thinking outside the box to how do we address the issue and solve the issue. It also generally is involved lots of new IP is generated as part of that process. It's quite competitive because different suppliers are coming up with different ideas, working to come up with the best solution. It generally is looking at the longer term development of a solution, so something that's going to work for a longer period of time and address all the different needs. And also it gives the advantage of a much wider market because you're working across multiple different countries, multiple different systems, also looking at different sort of frameworks and legal issues, and trying to address all of them. And another thing is it's done in multiple phases, so there's time for reflection, improvement, and optimization of the solution. So hopefully, get into that position where you've got something that's much more fit for purpose. So the core principles of a pre-commercial or a PCP is that we're looking for, it creates a pathway for public procurement. There's more interaction with a range of procurers to better understand the problem and produce solutions that work for many different systems. All the parties sharing the risk, so we're all working together as part of the process. You as the suppliers get much more access to us as the procurers, which sometimes can be a big barrier when you're working in health, is understanding the health system, getting access to within the health system and speaking to people there. This way you are interacting with us, you're talking to us, and we're in an open dialogue around the problems. It provides the opportunity to work in new markets as well, or develop into new markets, or develop even further into an existing market which you're working in. And it also enables you to actually work on a problem we're actually facing. So we're telling you what the issues are. We're actually asking you, can you please solve this problem for us? A key thing, I think, is, and we're going to talk about it a little bit more, I think, in the next slide as well, but you as the supplier retain the IP. And I think that's quite key. There's also financial aspects to developing the tools as well, which is great. And again, wide access to numerous different partners across on an EU level. So just to sort of reiterate on this part, so you as the supplier, you'll retain the IP. Attached to any results generated during the PCP implementation, but it is a bit of we would expect you to exploit that IP. That's what we're looking for. We're not looking for people to create things and sit on them. We're looking for these to actually be exploited further, and we'll talk a little bit about that in a minute. And there is financial compensation. So the financial compensation, it'll be calculated during the tender process of this, which again, I'll speak a little bit more about the tender process later. And there's some issues around that, some things around that, like the actual price which you quote by the supplier, and the market price is the price that the supplier would have quoted. So there's a few things to think about there, but that'll all become clear in the sort of tender process as we move through. And just to sort of sum up the PCP process, so it's a win-win for everyone. So the money is coming from taxpayers, obviously from a Horizon fund, but fundamentally, the money by being used in a PCP process means that that taxpayers' money is actually being used on something innovative, new, something that's potentially globally competitive. It's actually addressing a problem. It's potentially attractive for foreign investment and increased employment, because hopefully this solution could be used across the world to address the same issues that everybody else is facing. It's a win-win for us as the procurers, because we're actually getting something that we want. We're actually getting something that's tailor-made for the problems that we're facing. It allows us to have feedback on the solution as well. And we've got an open dialogue with the supplier and during the process. And so it's really beneficial to us as procurers, and equally for suppliers. You're getting valuable information. You're able to work within the market. You're getting ownership of the IP. You're getting to test under real-world conditions. And what does that mean? Well, we'll be providing data and information from our actual system, which you can use then to sort of optimize your models and optimize the solutions you're creating. And hopefully it shortens the time to market process as well for the solution, which we'll come on to in a little bit, looking at the sort of timelines that we're working towards. So the next section following the PCP, I'm going to talk about what a PCP is. I'm sort of going to talk about what the tendering process and the sort of the life cycle of what the suHCO project is, and how you as suppliers might fit into that, and also give you some really important dates to think about as we're doing it. So fundamentally, the project's split into 5 phases here. I know it says phase 3, but this sort of 5 phases. We're in phase 0 at the moment, and that is really what we're doing, is we're trying to understand the scope of what the project is. So we're doing lots of sort of research at the moment, and that's talking to the procurers, talking to people who work in our organisations and wider, to understand the problem around sustainability, understand where the barriers are, understand what the needs are, and we kind of finish that process, and we're sort of analysing the data, which again I'll talk a little bit about that in a minute. And then we're doing this next bit, which is the open market consultation, which is talking to you guys, the suppliers, to understand what your questions are, what any clarifications you need, to understand the process, and also if there's any other questions you might have around how this solution might be developed. And that process is going to run up until about July of this year. And then in July, we're hoping that we will have a tender document which will be produced, which we'll be able to publish in July, which will really sort of outline the tender process and all the rules around the tender process. And then there'll be a period of time there, I think it says December here, but I think we've got a bit more concrete dates later on. And basically, that period there is, you have, I think the deadline for producing your tender will be the 30th September, and then we'll be making decisions on which procurers and which suppliers to take forward. So in that period from July to December, you've got sort of 3 months or so to put in tenders, and then we have a few months then to make decisions on who those are going to be. And then in phase 1, we'll be taking a number of those suppliers. It says 5 here, but that's not set in stone at the moment. That's just a rule of thumb. We'll be taking 5 suppliers forward from that tender process to sort of develop the first phase of their solution. So they'll be showing us what the solution design is, and that'll be running from December to May of 27. And then phase 2, we'll be developing a prototype between May and January 28. And there'll be lots of sort of interaction with us, the procurers, and the suppliers in the development of those prototypes. And then from January to December 28, there'll be phase 3, which is the sort of development of the tool or of the solution. And as you can see there, it shows every sort of phase will be cutting down the number of suppliers taking the best ideas forward to the next stage. And then finally phase 4, which is kind of outside the scope of suHCO itself, but we're hoping at that point you will have a readily available tool or solution which can go out to market, and then by going through this PCP process, you'll have all that evidence, all that background knowledge to show how it works, and it's been designed with us. And then it's a public procurement innovative of the solution in across the different organisations and across Europe. So it's just, I think it's a good point. At this point, it's probably important to point out that this is not a grant; it's a tender process. We'll be asking for financial offers requested for each phase, up to a ceiling for each supplier. So when you put that offer in, it has to include all your costs, including potential tax. So there is there have been a few questions in previous OMCs around this, around whether VAT will be needed for some of these quotes and everything. So we're still working that out, and that is an answer we'll get back to you on. It's important to note as well at this point that whilst there are 3 procurers, the lead procurer is CSC in Spain, and so it's all one system. So all the invoices, all the contracts, all of that process will all go through CSC. You won't have to be sending invoices to all the different procurers. It'll all be handled centrally. One procurer who will be taking on the responsibility for the other procurers in that respect. Any payments that are made will be based on what has been offered as the financial offer, what you're saying you've done, and what work you've done, and it have to be in receipt of invoice and approval of the work. So the core requirements for suppliers, and this is quite an important slide. So I'm just going to read through this because I don't want to make any sort of shortcuts or inferences to it. I think it just needs to be explicitly stated. So a minimum of 50% of the project R&D activity budget must take place in the EU or Horizon Europe associated countries. So you have to be within the EU or the UK essentially, and must be spent most of your money on your R&D activities there. So if you have laboratories or work outside or places outside of the EU, and you're doing work there, that's fine, but you have to remember that over 50% or a minimum of 50% needs to be spent in the EU/UK. The tender is open to all types of operators, companies or other types of legal entities, regardless of size or governance structure, so anyone can take part. Both single entity or joint tender offers and subcontracting consortia are possible. So as we said earlier, there's lots of requirements in this around what you have to have expertise in or be able to do. So it's really important that you make sure you have all those expertise, and if you don't, something I'm going to talk about a bit later, there is opportunity to create a consortium. In fact, it's often quite advised to do so, to create a consortium if you don't have all those things in house, and there is an avenue to do that and build that up as well. The tender will be assessed on one exclusion and selection criteria, which will be based in the tender document. It'll be on-off award criteria and technical weighted award criteria, so that'll all be outlined. If you are not able to meet the selection criteria or expertise in health and care expertise, sustainability or AI, you need to get a partner. So again, I'm just reiterating there, it's important that if you are lacking in particular bits of expertise when we're doing the weighting and scoring during the tender process to pick those 5 those 5 groups or individuals, it's worth just looking to team up with somebody and build a consortium to address that. Participation in this event or any of the other OMCs is not a condition for submitting a tender. So if people don't make this, or if you're watching online, or if you're coming across this and you weren't at the OMC and you see this, yeah, you're still able to put in a tender. So I think it's important just to give some background on some of these, how the process will happen. As I said, we're expecting the tender publication in July 2026. No promises, but that is what we're hoping to get out of there, because that fits in with our timelines. The language for any of the documentation will be in English. Provisionally, so whilst the tender document will come out in July, submission of your tender will need to be done by the 30th of September 2026. So July, August, September, it doesn't seem like a lot of time. So it's important to maybe start thinking about the process now, and thinking about who your consortia is now, and getting that together, ready for that submission. The submission of the tender will be sort of split into different sections. It's administrative, how you're gonna administer the project. Technical, what your ideas are going to be, what you're going to be looking to do, and what expertise you have and your consortia have, if you have one. And then financial, some sort of understanding of how much it's going to cost to do and develop that solution. And everything will generally be handed through an electronic submission or a tender platform based with, so that should be straightforward. So the tendering process will handle through 3 sort of sections: contracting, monitoring, and then payments on completion. So the first section, you'll be doing framework agreements, which will give you the general terms, and there'll be specific contracts which will outline sort of deliverables, price, and each of the PCP phases. Okay, so at each phase there'll be a new contract coming along with what you're going to be doing at that phase, how much you're going to be doing, and how much it's going to cost you to do it. At each phase there'll be monitoring, so there'll be lots of contact. We'll be monitoring at different stages, and probably be monitoring against sort of expected outcomes. These will be like milestones you might have mentioned, deliverables and outputs, and some of the results you might have produced at that stage. And then completion. So each of the phases, we'll be looking at completion of milestones, deliverables, and requirements for payment, and then processing the payments. Sorry, I can't see what this is. So yeah, all contract invoices and payment processes are coordinated, by the lead procurer CSC. I've already mentioned that. So just to give you an understanding of the timeline of suHCO, so currently, as mentioned, we're in that phase 0. So we've done a procurer survey. Now we're holding the OMC events, and we will be doing a supplier survey, which will be coming live. We'll be asking people, and anybody who's been a part of any of the OMCs will be sent a link to that. And we'll be asking people to provide some information. And then during this phase, we're also looking for matchmaking and networking. So there's a number of QR codes I'll be sharing later for matchmaking services, or for looking for networking services, or just to get involved in the process. The next phase coming up in July will be the tender launch. So we'll be launching the tender with all the documentations and the rules and requirements. There'll be tender training events in September, just before the deadline, so early September. And then, as I said, the tender submission deadline at the moment we're working on is the 30th of September. There is a FAQ already online around this, and there's a link to it there, so when we share the slides or other stuff, we can get to look at that. And then once the tender selection process is up, we'll be doing a sort of tender evaluation from October to November, and then we'll get straight into it once we've picked the the suppliers or consortiums who are going to be running through the project. And then, as I said, I've already mentioned these, but it's worth saying them again just to give you an understanding of the deadlines. So then there'll be sort of December to April, co-designing phase 1, and then we're jumping into phase 2 then from May to December for developing the prototype, and then the rest of the following year is phase 3, so to do the pilots, get the data and run through the tool and critically assess its effectiveness. So now we've come to the Q&A session. I'll just go to the Q&A. We're going, just waiting to see if it loads, see if any questions have come up. Oh, that's not good. There's a problem reaching this app. Vinay, sorry. Vinay, have you got any access to the Q&A? Because it's not working.
It seems that there are no questions as of now.
Okay.
Yeah, I've enabled mic and cameras for any participants to directly ask their questions to the presenters.
Okay. Are there any questions anybody has? We've got someone typing in chat. Asking here if there is an issue. Yeah, we have an issues with the Q&A as well. Any particular reason why the project is expected to start in December and not January, i.e. to avoid Christmas madness? Yeah, that's a good point actually, and that's something we can bring back around looking at that deadline. Yeah, I think, and also it'll be looking at doing all the contracting. It'll be hard to get done over Christmas as well. So yeah, that's something to think about around deadlines. Thank you for that one. We'll bring that back to the main group for discussion to shift maybe that deadline. Any other questions?
Feel free to use the chat or just to unmute if you have any questions.
Yeah, you should be able to unmute. Oh, are there any hard requirements in terms of hosting, etc., other than complying with GDPR and EU best practices? In terms of hosting, I don't think so.
Not that I'm aware of.
Not that I'm aware of. No.
Everything will be within the tender document published as well if there are any other requirements. Thank you.
Yeah, thank you.
Also feel free to introduce yourselves in the chat, and potentially you could pick up further conversations with other suppliers after the meeting.
Okay, we have another person typed in.
Fantastic.
Do we have any other questions? Yeah, okay. This is Sam Business from Health Tech. Are we going to get the slides after the meeting? Yes, so also the recording will be provided. I'll also talk about some other things which are going on, which might be of interest as well, because I've got a few more slides to ask in a minute, to show you in a minute, so yeah. So perhaps if people want to put stuff in the chat, that's fine, and we'll maybe answer them towards the end as well. But what I'll do now is I'll probably start talking about some other things that we're working on. The next steps which I'm going to talk about are sort of register for other OMC/matchmaking. So just to say, so obviously, There we go. So just to say, obviously, we have this is the open market consultation in Wales. There's already been 2 other open market consultations. There is an open market consultation, an international one, which will be held in English. Registrations are still open for that. It's on the 26th of February. And whilst you might say, oh, I've already gone to an OMC, do I need to go to another one? So here's the QR code if you want to click on there and do it, but it's also in the chat. EnEA's put it in the chat for you. This one will be a little bit more extensive. So I know Amy mentioned earlier, we've done a lot of sort of surveys with procurers and meetings with procurers and people who work in health organisations. So a lot of the results from that will hopefully be presented also in the open market consultations, so there'll be a bit more understanding of the process. So if you are really interested, I think it is still very worthwhile going to the international open market consultation, because there'll potentially be even more information there for you as well. This is just a bit of a taster. There'll be more information and hopefully some more direction on what we found so far and a bit more understanding of what we needed in the solution. So this bit's around the matchmaking. So as I said before, around building that consortium. Yeah, and EnEA's put something in the chat there you can link to it, but there's also a QR code if you would like. It's really worthwhile. Again, if you're interested, even if you're just looking to partner with somebody else, to go on that matchmaking platform. It only takes about 5 minutes to fill out. All we're really asking for you to do is sort of say what you're looking for, what you're offering, and then some contact details. And then you'll be able to, within 1 working day, you'll be on the site, and you'll also be able to see all the other people who've added into the matchmaking platform. And it's an opportunity to start networking with them, talking to them, seeing what they have to offer, and seeing whether it works with what you do, and to see if there's something you can start having those conversations, contacting them and starting to build that consortium early on. So it's worthwhile doing. Okay. So anybody who's registered for the OMCs, we will be providing a supplier survey, which we mentioned earlier. What we're looking for is people to fill that out. It'll really help us sort of define the scope and challenge. It'll really help us get clarity on the challenge, so the building blocks and the needs areas. It'll provide feasibility and complexity of the projects. We're asking you to develop something, and it'll be your opportunity to say, well, this is, what your thoughts on that problem are. It'll give you feedback on the PCP timeline and budget distribution across phases. I'm sure that's something that everyone's quite keen to understand in more detail, is what money is available and what are the timelines, what are the deliverables needed at each stage. So it'll help provide some background on that, and then some more experience and familiarity with the PCP process. Yeah, so that'll be coming up after this is the last national OMC, so that'll be coming up after this, and we'll be sending that through to everyone. And then finally, just asking people to to just get involved. EnEA's put some stuff on there, so there's a LinkedIn. There's also a QR code there to join and to link up with us on LinkedIn. I think that would be really helpful if you can. We've got about 139 followers at the moment, and we'd love to really increase that significantly. We have a newsletter, so you can keep up to date on progress and things which are coming on. And also there's a website we have which you can visit, which will have a lot more of the detail of this stuff, and where a lot of these OMCs will be published, and you'll be able to watch them, and also perhaps get slide decks as well. Okay, that's me finished. So I'll just give it another opportunity. If you do have any further questions, please do feel free to put them in chat. Is there anything from anyone? If not, that is the end of the UMC. Please feel free to contact us separately or to get in contact with us. We'll be more than happy to answer or provide some more information where possible.